So, in today's meeting, we're going to be covering a couple things. We're going to be telling the story behind our alliance with CBS. We're going to be providing a primer on billing services and revenue cycle management. We're going to talk about why or why not using a billing service could be the right move for your clinic. And lastly, there's going to be a brief Q&A towards the end of the call. So on that note, we wanted to take a moment to go over a few housekeeping items. This webinar is being recorded and will be posted on our YouTube channel afterwards. So if you want to watch it again or share it with a friend, you're more than welcome to. We've muted all of the attendees, so there won't be any interruptions from your neighbor's dog barking in the background. You will not need your webcam either. And if you have any questions, please hold them until the end of the meeting, and you'll be able to type them in the chat box. And Steve and Kimberly are going to have an opportunity to read the answers to you. So without any further ado, I'm going to hand it over to Steve, and he's going to kick us off.
Very good. Welcome, Matt. I'm just making sure everybody can hear me. Matt, can you hear me okay? Can you see me okay?
Loud and clear.
Excellent. Excellent. Well, again, welcome, everybody. We're still expecting a number of people to join, so we'll start off a little bit slowly. So again, I want to thank you for taking the time to join us today, taking time out of your day to find out about what we're up to here. So just some introductions for those who may not know who I am. I'm Stephen Pressman. I'm the founder and the CEO and the chief bottle washer of Practice Perfect EMR. Again, for those of you that may not know much about us, even though you are clients, we've been in operation since about 2001. Very, very different company now than it was then. Very different application than it is now. We have around 2,000 practices using Practice Perfect, primarily made up of physical therapy, occupational therapy, speech therapy, mental health. There are others as well. We have some acupuncture, some chiropractors, that sort of thing, but really PTOT, speech and mental health are the core of what we do. A growing number of pediatric. I would say probably a good 30 to 40% of our clinics are now pediatric as opposed to adult. And even though we don't track this specifically, we're guessing we have 25 to 30,000 practitioners that are using Practice Perfect. Now, something that you may not know about, or the reason that we began the company to begin with, the whole goal of designing an EMR. We have people in the waiting room. Hold on, Matt. Can you deal with it? I think I have to do the waiting room. I don't know if you can do the waiting room because I'm the host of the meeting here. So bear with me for a moment. Let me just make sure I have everybody in the waiting room. I think that's everybody. No, there's more in it all. Sorry about that. Very good. Again, so the whole reason that we had developed Practice Perfect, many couple decades ago, is my background was all having to do with using software, using applications to basically grow a practice to help enhance a practice, not just sort of replace billing, scheduling, that sort of thing. It was all about being able to help grow a practice. So ways of using the software to grow revenue, to make the cash flow better, to get cash coming in, to make customer service better, to make people more productive, to track productivity, to track issues potentially that are happening in the practice. So a lot of our application is very much geared around, again, helping a clinic to build, to grow, to maximize efficiency, that sort of thing. And a lot of you don't know that, and that comes from a lot of the reporting in the system. So again, if there's certainly, we can address some questions about that afterwards, but that was in essence the entire reason for developing Practice Perfect, to try and come up with an application that would help the practice, basically enhance itself. So that's kind of our mantra. And now let me just click to the next screen here. Bear with me. Boop, boop. I'm going to let Kimberly say a couple words about Kimberly. Kim, over to you.
Good morning. Nice of you all to join us this morning. So I'm Kimberly Gordon. I am the COO of Clinical Billing Solutions. I started with this company. The company's been in business for the last 25 years. We're coming up on our anniversary next month, so we're excited about that. I actually started on Halloween Day, 2005, walked into an office of the Wicked Witch of the West, Marilyn Monroe, and Dorothy from The Wizard of Oz. Kind of thought I was in the wrong spot, but all worked out. I started with them in an accounting and operations role. I became their general operations manager in 2009. I took over complete operations at that point in time. And now I am now the COO and part owner of the company, which I'm super excited about. So the origin story for the company itself is just like you guys. There were a number of PTs and OTs sitting around one night after a conference, and they were all complaining about their in-house billing solutions. They had one person and somebody got married and left, or they got pregnant or took a vacation or whatever, and it ended up causing them issues within their billing cycle. So they all decided that maybe if they pooled their resources, that it would make it a better solution for all of them, and then they would have redundancies set in. So they did start that, and then quickly realized that none of them had any idea on what to do for medical billing itself. So they decided to go ahead and form a company, which they did. Originally it was Clinical Practice Management, which we've now renamed to Clinical Billing Solutions. And they hired a number of professionals in medical billing. That's how I came on board. So over that time frame, they did decide to keep it specialized within OT, PT, speech, ABA, which is how we actually ended up getting connected with Steve, because he had the exact same specialty area. So it made it a good fit. So that's pretty much how we came to be and what we're doing. Steve, you want me to go straight into the process?
Yes. So basically, what I'd like Kimberly to do is we're going to sort of jump right into, I guess, a bit about Clinical Billing Solutions, exactly what they do, exactly what we'll get into what revenue cycle management is all about. Then we're going to talk a bit about what we're doing with Clinical Billing Solutions. So Kimberly, if you can do just sort of a bit about what you guys do, and a bit about what your goal is, what you hope to accomplish with the clinics. Then we'll come back and talk about why we aligned, and then we'll get into the meat of things with the revenue cycle management.
Sure. So, all of you know what billing is, and most people think of billing as basically getting the claims out the doors and the payments back in the house. Revenue cycle management includes all that and a little bit more. So what we do here is before the billing even goes out the door, we start with what we call pre-audits. We pre-audit patient demographics. We pre-audit, the charges that are submitted, basically what you call claims scrubbing, on top of what the program itself does and the clearinghouses do. So we do all that extra scrubbing, set up, make sure that we're maintaining the payer tables and their requirements, and then we submit to the billing or to the clearinghouses. With the clearinghouses, you have to understand the interactions between the clearinghouses, the payers, and the software. And that's what we specialize in. We've spent many years with Practice Perfect, and we've got that dialed in pretty well. So the changes in payer requirements over the years are things that we keep on top of. A great example of that is with COVID, telehealth came about, and every payer did not handle telehealth the same way. Some of them required place of service or place of location changes. Some of them required modifiers. Some of them required one or the other or both. And those are the types of things that we work on with Practice Perfect, with the clearinghouses, and with the payers to make sure that we're staying on top of those things. After claims go out, obviously, your payments come back, and then the payments, we get those posted. We work to streamline that process. We work with Practice Perfect to make sure that we are being able to capture as much stuff electronically as possible, as well as working with the clearinghouses for that purpose. More and more these days, the payers are trying to hit you with charges to run virtual credit cards and things like that. So we do help optimize moving that stuff to an EFT format as much as possible. Okay. The next part of the system, and this is the part that actually doesn't get worked on quite as well, is the denial management and appeals. When I started back in 2005, the average denial rate by the insurance companies was about 3% overall for all claims that were coming in. And I recently was in a webinar with one of the major clearinghouses that said on average now 11% of all claims from insurance companies are being denied. So that actually turns out to be quite a hefty amount of your revenue when you then consider, because of the high cost and time involved with working those denials, about 83% of those are just not even acknowledged at all. And so they're let go. That actually equates out to be about 10% of your expected income. So quite significant amount. On top of that, then you have your AR, and what did you not hear anything about? And that actually typically comes out to be about another 5 to 10% of your revenue. So those are the things that we specialize in here, following up on those claim denials and following up on the AR management.
Okay. So I want to talk a little bit, thank you, Kimberly. I want to talk a little bit about why we decided and why Clinical Billing Solutions decided to sort of, to become involved together from our perspective. Then we're going to get back into a bit more of the meat and potatoes as to what exactly Clinical Billing Solutions does, and revenue cycle management, that sort of thing. So first of all, we've been working with Kimberly for about 10 years. We have, I think, several dozen, probably 2 or 3 dozen joint clients that use both us and Kimberly's service. So what happened is earlier this year, Practice Perfect acquired an ownership stake in Clinical Billing Solutions. The expression, the whole is greater than the sum of its parts. Aristotle, very long time ago. I have no idea when that was said, but basically we do believe that together we are a stronger force than 2 separate entities. The reason we did that, as I mentioned before, that one of our key goals with Practice Perfect is to, again, enhance the cash flow and enhance the operation of the practice. So we do focus now, Practice Perfect, on everything from intake to discharge. For those of you that may not know that, we do have an online client portal. Patients can actually enter their information online, book their appointments online before they even walk into the clinic. So everything from the moment the patient decides to come to your clinic to the moment they're discharged is covered by Practice Perfect, including their notes and their billing and tracking receivables and all that key information. The one thing we never did, though, was collections. We could give you the tools to see who owed you the money, but the one piece that was always missing was the actual assistance in doing the billing and doing the collection. Sure, we gave you the tools to do it, but people weren't using them necessarily. This acquisition helps us to offer basically the complete cycle. So now we've closed that gap, and now we do feel that we offer everything from intake to discharge, including the collection. So that was kind of a key thing for us. It was a very, very good fit. Now, how does this benefit Kimberly's company? Well, basically, Clinical Billing Solutions now gains access to kind of their very own EMR. They have a lot of input into what Practice Perfect is going to look like. So now Clinical Billing Solutions is not purely relying on Practice Perfect. They have direct access to help shape Practice Perfect. So basically, they have a technology, a say in development, a say in how billing and remittance is going to work, and tracking accounts receivable, management tools, all that sort of thing. So basically, we've now given Clinical Billing Solutions access to technology that they need. Very, very few medical billing services, at least the ones that I'm aware of, can lay claim to having their own EMR. The majority of them say, yeah, we work with X or we work with Y, but all they are is a client of X or Y. They don't have any direct input into the operation of those particular EMRs. This is a very, very unique situation, which definitely benefits both of our entities. Just continuing along here. So I am going to hand it back to Kimberly. This is more sort of a more nuts and bolts explanation as to exactly what revenue cycle management is, some of the ups and the downs and the little bits and pieces of it. And again, how Kimberly sort of helps with that. Now, Kimberly, you let me know when you're finished, and I'll move back onto you just give me the word, and I'll move back onto my next slide.
Okay. Yeah, I think I probably jumped the gun a little bit on this before, but on what we do with revenue cycle management. So it's really about what do we take off your plate. We approach everything as a team with you. So the things that we're taking off of your plate, as I talked about before, are those new patient audits. We're going to pre-scrub everything before we're sending it out. We're going to work with the clearinghouses and work with the payer rejections and work with the optimization of not only Practice Perfect, but with your clearinghouses as well. I run into quite a few issues where it's just Practice Perfect has the ability to do something, but it's not dialed in exactly the way it needs to be for a clearinghouse. So understanding those connections is important. But our big thing here after all of that is the denial and appeal management and recovering revenue. I have a staff of 15 people that's what they do. They're on the phone all day long, actually following up on these denials, which is very time consuming in and of itself. And that's the piece that I think a lot of small companies miss out on, is that follow-up. The other thing that we deal with all the time are the patients themselves. So if your patient has a question about why do I owe money, if they call you, you have to be able to answer that. You have to be able to understand their coinsurance, their copays, their deductibles, and things like that. And sometimes the insurances process those wrong. So we work with the patients and their insurance companies to make sure that they do get processed correctly. On top of that, we will typically at the end of every month, we run reports out of Practice Perfect. And a lot of people run reports, but don't look at them. They don't know what they mean. So we actually do a lot of review and analysis with you to the level that you need in order to get better information out of your system and make better, business decisions down the line. So all of this is in the hopes of being able to clear up time off of your staff so that they can dedicate time to, patient care, to making sure that they're checking eligibility and benefits and getting correct authorizations, and maybe even expanding the number of patients that you can see. A lot of times I talk to owners of clinics like yours, and they're the ones who are actually doing the billing, which means that they're not treating. So there's lost revenue there as well. So that is revenue cycle in a really quick nutshell. Obviously, there's other items that are included that we're not talking about today, which include things like credentialing and contracting and things like that as well. But those are a discussion for another day. So Steve, I think that gives it in a nutshell. Do you want any more details on?
No, it sounds pretty good. I think it's a nice fancy word for we want our money.
Yeah.
But no, there's a lot of elements to it, and I don't think that people know all the nuances behind it. I think there's a lot that goes on that people assume everything is being done, but it's not. There's a lot to it. So I do want to talk about why I use a billing company, and I want to stress this is from my perspective. And again, I didn't come from a billing company background. We're an EMR, and I got to be honest. Kind of in the earlier days of doing this, I thought, look, if you bill it, you're going to get paid for it. So why give anything away? Why use a billing company? It seems if you're billing, you're used to billing, why, just send the things out the door, you get paid. And then over the years, things have changed and my mind has changed. So I'm a convert at this point in time. So what we're finding from an EMR, what we're finding from people calling our support department is there's a growing insurer resistance to paying claims. They're not just sort of handing out the money as freely as they used to. There's certainly increased regulation, requirements, and many more hoops to jump through. So a lot of times now they're asking for, proof of medical need. They're asking for copies of notes. Verifying that the units match the schedule. Verifying that you're not billing without the goals changing, that sort of thing. If the goals are not moving anywhere, then why are we still treating them medical necessity? So more and more hoops. It seems the insurance company's job is slowly becoming primarily not paying claims. It's becoming a real challenge, especially with some insurance companies to actually collect what you've been billed for. They also make it very tricky. They're denying some things. They're clawing back little bits and pieces with the hopes that you're not going to follow up on it. Okay, well, they took $20 from that. Well, it's not worth my time to make a phone call. We're seeing that happening as well. Admin staff generally, and I don't mean this in any offense to anybody who's watching this particular webinar, admin staff typically are trained by their predecessors. And not actually trained in medical billing. They're trained how to do their job, and billing is one small piece of or a large piece of the job, but basically they're not trained as medical billers. They're trained as administrative staff, customer service representatives. Collection activities I find with the admin staff that we are dealing with, and again, I don't mean any offense by this, are typically low priority. What I call the in-your-face tasks win. What's an in-your-face task? The phone rings, the patient shows up, at your front desk. Someone wants to pay you. Those are the in-your-face tasks. You got to deal with them right away while the clinic is open, 9 to 5, whatever. Things like making collection calls, bugging patients for money, getting on the phone about that $10 charge that wasn't paid, that tends to get pushed down the line to the end of the day if there is time at all to deal with it, because the other stuff has to be dealt with right away. It cannot be put off. Easy stuff gets paid. Hard stuff typically does not. As Kimberly was saying, I don't remember the exact percentage, but something like 11 or 12% of all claims simply just don't even get paid, and the clinic's not even aware of it. They go, okay, well, we're used to a 10% write-off, so we're just going to accept it. In a lot of cases, vacation time with the admin staff, the billing staff, just means loss of cash flow. Things don't get done. Things age out, which means they're no longer collectible or can no longer be resubmitted. There's a lot of that going on, and a lot of money is being left on the table, to be perfectly blunt. So that's why I'm kind of now a convert with the concept of using using a billing company. The other thing that we find, I'm just going to admit someone else here. By the way, anyone who's joined late, this is going to be recorded and posted, so feel free to to go back and take a look, and we'll send a link out to everybody when that happens. So the other thing I find, and again, this is our perspective in dealing with dealing with the clinics, from what we're hearing from people calling the support department, typically in a panic, is you have backups of your data. We back up your data if we're hosting your data. You're backing up your data, but you're not backing up your people. If your people vanish, you got a problem. So a billing company, I find, also asks is what I call people insurance. If someone leaves your organization, that could be a big problem. With a billing company, there's a team of people that work at Kimberly's at clinical billing solution. There's a whole bunch of people. If one person's away, nothing changes. Your account is still being worked on. Collections are still being done. The knowledge is a group knowledge. It's not individual knowledge. Somebody always knows what's going on. Most clinics, again, not all clinics, but most clinics do not have redundancy, or what I call adequate redundancy. They don't have someone who can pick up and go with the billing if someone else decides to leave the facility. No one considers what if my biller was hit by a bus tomorrow? What would I do? What would that look like if my chief admin person all of a sudden couldn't come into the clinic? What would I find? So these are true stories. These are not made up stories. Since January this year, we're talking about 5 months, 6 months into the year. Unfortunately, we've had 2 clinic admin staff unexpectedly pass away. It sounds horrible. I'm not meaning to make light of it, but it's happened, and it's left a couple clinics on the lurch. 4 clinics admin have unexpectedly resigned. They've taken jobs elsewhere. In some cases, they do have time to train somebody else, but not fully. One was let go for fraud. And then we run into this all the time, is sometimes the owner then finds what I call the drawer of shame. The drawer of shame is all of those claims and all those notes and all those stuff that never got collected, that got shoved in the bottom drawer in the hopes that they would be dealt with by the admin person one day, and they never dealt with it. The drawer of shame. And lastly, none of these clinics had adequate redundancy. Maybe they thought they did, but they didn't. None of these clinic owners had a clue about their own billing processes. Again, I'm not disparaging clinic owners. Typically, they should be treating patients, not dealing with billing. And ironically, all of these clinics have since had a discussion with Kimberly. I'm not sure what's happened with those discussions, but I know they've all had discussions with Kimberly. So my big concern with the use of a billing company is, in essence, this redundancy, this ability of an entire team to be able to handle your collections. The team is always there. They don't go on vacation. They don't get sick. They don't quit. They don't get fired. It's insurance, and things continue along if there is an issue with collections. So it's turned to me over the years to a complete proponent of using billing services. So now we want to turn to, okay, we talked about why use a billing company. Well, why use our billing company? What makes Clinical Billing Solutions a little bit different? And I do have a couple of reasons I'm going to go into, but I wanted Kimberly to have an opportunity to talk to you a bit more about sort of her take on the operations and why Kimberly does believe that they excel at this particular field. So Kimberly, I'm going to hand that back over to you.
Yeah, thank you. So the first the first thing with the billing company and our billing company is that versus what you're doing in-house is that we take a dynamic versus a linear approach to how you're working on things. As Steve pointed out before, it's a matter of what is your in-staff able to do. They're one person, so they have to work task 1, 2, 3, 4, 5, and usually they don't get to 5. So with our approach, I have multiple departments, and so your account isn't worked on by one person, it's worked on by 3 different teams of people. And so that allows us for each of those teams to specialize and focus on those tasks. And so they become very expert at each of those items. And additionally, they're able to do additional research into, payer changes and stay on top of things like that. They understand if they see something on an EOB, what it means, or that it's a change in something. So the ability to work in a dynamic approach also means that I don't have to get the billing out the door in order for us to then work on the denials or the AR management. All 3 of those functions happen at the same time simultaneously. With the redundancy, Steve is right. I have the redundancy that you don't. Each of my departments has multiple people, and yes, they all take a vacation here and there, they're sick here and there, but that also means there's 5 other people that can cover their desk, including me. I cover everybody's desks if need be. And then on that, we have workflows in place so that we know where everybody's workflow is. If somebody's out, we know how to cover for it. And we've made compensations in our policies for that. With the expert and guidance, like I said before, I have everybody in departments that know their stuff. 90% of my staff actually came from a medical billing school. I deal with 2 of the medical billing schools here locally, and I've been on their advisory board for very many years. So just like where I can help Steve, developing his program, I've helped them develop their programs as well. That also means that just like you went to school to learn your specialty, my staff went to school to learn their specialty. It's not like hiring somebody who may or may not know that, and they're learning from somebody who knows certain things. So we have the ability to expand upon that relationship with the medical billing schools and bring their students in, do externships with them. We identify the best and the brightest that we then bring on to our staff full time. The majority of my staff, all my core staff, have been here for multiple years. Most of them have been here for over 10 years. And so we have a good core group of people that are running all the different operations within the company. Let's see, cost savings and efficiency. So one of the big things is everybody always asks, what's the cost for a medical billing company? And obviously there is a cost involved, and it's a percentage of what the collections are for everything that is billed out. And everybody's like, okay, well, I can't afford that cost. What you don't realize is what you've lost by not outsourcing. With all of the denials that you're not working, with all of the AR that's not being followed up on, in almost all situations, that exceeds the amount that you're going to pay out to a medical billing company, as long as those things are being done. So there are medical billing companies out there that only look for the easy and fast money, and they'll charge you less money than I will, but I'm going after the harder money. So there is a cost involved in that, but we are working on as many efficiencies as possible to keep that cost as low for you as possible. And that includes this relationship with Steve and Practice Perfect. So we work on that on a daily basis to increase those efficiencies and keep the costs to you as minimal as possible. And then on top of those cost savings is your revenue optimization. By taking these things off of your plate, then what you're able to do is pay more attention to your patients, maybe go after revenue sources that you haven't gone after because you don't have the time to do it, create programs within your system for groups or whatever it is, and then put your time and attention where it needs to be, which is with the patients and treating and bringing in the revenue. So those are the things that we typically will take off of your plate. We always approach this as a team effort with you and make sure that we're just an extension of what you guys are currently doing.
Very good, very good. So I did want to talk a little bit about, some of you may already be using a billing company. So I wanted to spend some time talking about, okay, that's great. You understand the value of a billing company, but why should you be using a billing company that's aligned with your particular EMR? What's the benefit in dealing with a billing company that also has sort of input into your EMR, where there is a partnership? And there's a lot of benefit to this, which is, again, another reason why we did get involved with clinical billing solutions. First of all, everything is in one place. You're entering your charges, perhaps, you're entering your patient information. Kimberly has direct access to that information. They aren't taking your billing, entering it into some other system, which takes time and lots of room for error. Everything is being done in one place. It's being done with one point of entry. Everything is up to the moment. You don't have to think, oh, I put in this charge, I'm going to wait to put in my charges, and then it takes another couple of days for Kimberly to put in the charges. Everything is the moment. The moment you enter the information into the system, the Clinical Billing Solutions has access to that information, so there's no delay. What that means is there's real-time information about cash flow, receivables, and collection efforts. So again, to be blunt, what we hear from clinics is, well, how do I know the billing company is doing anything? What's the benefit? Are they actually, making collection efforts? Well, in our particular case, it's clear as day. You can see right away up to the moment, any funds have been deposited as a result and entered into Practice Perfect as a result of a collection or a billing company's efforts. You can run receivables reports anytime you want. They're the same reports that Kimberly is working off of. If a patient phones you about something, you can see the information that Clinical Billing Solutions was relaying to the patient. And most importantly, because of things like the contact log in Practice Perfect, you can see what efforts the Clinical Billing Solutions has made. You can see, oh, yes, I see they did call you about money. I see this did happen. So by having the same application used by the billing company as used by the EMR, it's all live. No double entry, instant access to information. The other thing is there's no finger pointing. We hear this all the time. My billing company said that it's you guys. You're not sending us the right information. Or we say, well, I don't understand. You build it here one way and you're in Practice Perfect, but your billing company is billing it as something else altogether. That doesn't happen. Again, we don't know why that happens. We don't know why there's disparity between us and potentially another billing company. But that just does not happen here. Modifiers are sent right over, CPT codes are sent right over, units are sent right over. There is no room for some kind of misinterpretation. We're sharing goals of what I call goals of automation. What Kimberly would like to see, what we would like to see is aligned. We're trying to find ways to really streamline things, to really, help the scrubbing process, to get things paid faster. Are there ways in Practice Perfect of making sure people aren't billing the wrong things, of locking certain things out? I'm not allowed to bill a 97110 to a particular payer, that sort of thing. So the more that we can build in with Kimberly's expertise and guidance, the better it is for everybody. Again, very unique that the Clinical Billing Solutions as a billing company has access to an EMR and to the development of an EMR and sort of direct access. Because of Kimberly's association with us, we're going to be able to leverage all kind of cool technology we're working on. For those of you using the wired client, which has become incredibly popular, we're getting to the point where you'll be able to text your statements to your patients to collect. We're already doing online payments. So imagine all of your patients who are overdue, get a text, hey, you're overdue, click here to see your statement, click here to pay your bill online. No other medical billing company, to my knowledge, has access to that sort of technology. And that's purely because of the fact that, that we're working very closely, working together on the same thing. So again, a lot of benefits in the EMR and the billing company being one and the same. And I want to send this back to Kimberly, just another little push from Kimberly, a couple more points about Clinical Billing Solutions and what makes them a little bit different than some of the other entities out there. So Kimberly, back to you for a moment.
Okay, thank you. Yeah, so one of the things with us is our flexibility. We work with a number of different size clients. I mean, I have a client that's a single guy who does home health, and I have a client that has multiple locations, 5 locations and 40, 50 providers, and they're huge, right? So we work with everything from the smallest guy to the biggest guys. And because of that, it's not a one size fits all solution. So what we do for the little guy might be vastly different than what we're doing for a larger clinic. So we have some core procedures that we like to try to keep towards, but we actually make those flexible based on the needs of our clients. So Practice Perfect, the program in and of itself, is an incredibly flexible program, which is one of the reasons, I aligned with them 12 years ago. And so that flexibility is something that we like to be able to offer to our clients as well. Our focus is only on PT, OT, speech, hearing, ABA, mental health. We don't do every other type of specialty out there. So we become experts in these areas. And again, it aligns really well with what Steve's program does. And a lot of medical billing companies out there, they do everything. So they're not a specialist in anything, and they just go through the motions on some things, and they may not know about KX modifiers or whatever it is, right? So we do become very focused just on our areas. I also don't offshore anything. Everything stays here. And so you won't have a patient who's calling a foreign country and doesn't understand the person who is trying to explain their bill to them, or you having a question. So I have staff here that you can call, email anytime. We always have a primary contact for every client, along with multiple other contacts that will answer questions for them depending on what it is. But at the end of the day, we're a small business trying to help other small businesses like yours. And we keep that mentality of that every client's important for a reason. And we remember that, what we do impacts your lives as well. And that's what we're after. We're after, making a positive impact on your life.
Very good. Thank you very much. So now I want to talk a little bit about, should you specifically, each one of you, use a billing company? And in all candor, it may not be for everybody. I mean, if you're a very small practice and you're billing the same one or two CPT codes to the same one or two insurance companies, and again, in all candor, and things don't sort of change, then it may not be for you. It may not be worth giving away, a small percentage of the revenue. But in most cases, I do believe there is a benefit, at least for certain segments of the business. So a couple of things just to look at, just to be a bit introspective. Your collection rates. What percentage of your allowable, not what percentage of your billing, because we all know what your billing is kind of a bit of a nonsense number. The insurance companies only allow a certain amount, but what percentage of your allowable do you collect? And again, I don't know, maybe I should ask Kimberly this, if there's an industry standard or not. Is 90%, are you happy with 90% of what you're billing you're collecting? Should you be getting 100%? Is 98% acceptable? I mean, if you're giving away 10%, that's a lot of money just because you're not working on your claims. So basically, are you working for free at times? How much of your time is if you're spending 10% of your time or 15% of your claims aren't getting paid, well, that basically 1 hour of your day you're working for free. So again, I'm personally not sure what the industry standard is, but it's something you should be looking at yourself. What percentage of what you're billing are you, again, you're allowable, are you actually collecting? Be very interesting to see that number. And again, I don't know the industry standard, but it'd be interesting. Number two, could you be the next horror story? We hope not, based on the things I was talking about before. Do you see yourself as being potentially exposed? When you look at your own practices, do you look around and go, that story Steve told could very well happen to us? Or no, we have a lot of redundancy and we're good at this. And in which case, that's great. Could you gain in revenue more than basically what Kimberly's clinical billing service or solutions cost? I mean, again, if you're giving away 10-15%, then something the service would definitely pay for itself. Here's a big one. I find with the clinics, are collection calls being made until completed or when possible? So what I mean by that is, are all of your collection calls being made by the end of every week? Is everybody with an outstanding balance being contacted, or only as many calls as you have time to do? Are your collection calls ever completed, or are they just being done when time permits? That to me is kind of the big problem that I see the clinics having. These collection calls get pushed down the road because they're not they're not crucial. They're not crucial to the operation of the practice on a day-to-day basis. And more importantly, could billing staff, clinical admin or admin staff, clinical staff, could staff be diverted to other potentially revenue-generating projects, but they're stuck in the muck of doing collections? So could you come up with some new program for your practice where you can generate another 10 or 20 or 30%, in revenue, but you just don't get around to it? I can tell you personally, I got a whole pile of stuff that we never get to because we're so busy being busy. And that's definitely something that Clinical Billing Solutions can assist with. So that's a bit about what we, a bit about both of our companies, a bit about why we've done this, a bit about my personal beliefs about billing companies. It's a good bunch of information about what Clinical Billing Solutions does. We do want to open the floor up to questions, which I think Matt is going to moderate. We have been asked, there's a couple that have been asked over and over again, which is, what does this all cost? I'm going to let Kimberly speak to that before we even get to the questions, because that's a big one. What does everything cost? One person asked us if there's going to be snacks. Well, I think by now you're probably aware there are no snacks. So I'm sorry about that, even though it's lunchtime for some people. Is this integrated with Practice Perfect was a question that came up. Well, yes, I did an entire section on that. It's completely, fully integrated with Practice Perfect. So anyway, Kimberly, maybe you can talk as much as you're comfortable about with a little bit about, about how the pricing structure does work. And then we'll let Matt moderate the chat. And by the way, anybody have any questions? Now's the time. Type them into the chat. We're not going to unmute, and Matt will sort of filter through them and get to them all. But Kimberly, maybe I'm sure a lot will be about pricing. Maybe you can address that a little bit.
Yeah, pricing is always, the big question, right? So of course it depends on a number of factors. It depends on how automated you are, but typically it runs between 6 and 7, 8% of the collections, not of what's billed out, but of what's actually collected. It's going to depend on if I'm including clearinghouse, charges in my fees, or if you have your own clearinghouse, or if you have a lot of EFT, or if it's all manual, or things like that. So we do take all those things into consideration. Size also is a factor. So smaller guys, I have less flexibility with, because there's a core amount of work that needs to be done for every client, regardless of size. Bigger clients, I have a little more flexibility on, but typically on average, it's 6 or 7%.
Okay, very good. And Kimberly, just to jump the gun on a couple of questions, you talked a bit about credentialing. Credentialing has become a real pain in the butt of late. How much of that can you assist with? Is it a very specific situation?
Yeah, so I've done credentialing on and off for clients for the last 15 years. So while I say I'm good at credentialing, I am definitely not an expert like a credentialing service themselves would be, but I've dealt with adding, I've reviewed contracts before. I can definitely help out with all of that. We do offer credentialing services, and it depends on what your needs are. If it's just adding payers or adding providers to an existing contract, those are usually fairly easy. If it's, reviewing a contract with you or helping fill out an application for a new contract, I've dealt with all the major insurance companies. I've dealt with Medicare before, some of the Medicaids throughout the different states. So we've dealt with all of it, and we can definitely have a conversation with anybody about credentialing needs.
Okay, very good. And the other thing that, just to jump the gun, I'm sure the questions are going to come up about eligibility. And I want to say something about clearinghouses, but what do you do about eligibility?
Yeah, so I typically eligibility and benefits checks and authorizations are left in the hands of the clinic. I do highly suggest for eligibility and benefits to use the functions at a clearinghouse. They're very cost effective for what they're doing. The biggest problem does become authorizations, and I do leave that at the clinic level, just because you guys know whether you're going to need more authorizations. And a lot of times we're not seeing the information until after you've treated a patient. So I always feel that, again, it's that teamwork with your staff and our staff. And those are one of the functions that we leave there. Now, in a pinch, you guys need some help, we're always happy to help out with that kind of stuff.
Okay. Which leads me to a topic having to do with clearinghouses. Right now, we don't have anything hard and fast. We don't have any hard and fast sort of rules or alliance with a clearinghouse. We have our favorites. but we like Waystar specifically, but we don't have any kind of an arrangement with anybody specifically. What we are looking at between Kimberly's volume and our volume is arranging some sort of discounting on on a specific clearinghouse. So we are working based with all of our volumes. Another reason for us to be working together and hopefully coming up with some kind of an arrangement where we can get everybody who's interested onto a clearinghouse at a bit of a discounted rate. The other thing is that within Practice Perfect, we are actually looking at adding in eligibility. So you will be able to, in a not too distant future, be able to, with most clearinghouses or with some clearinghouses in any case, you will be able to query a patient's eligibility without having to make a phone call. That being said, some areas, for example, ABA eligibility is very, very tricky to get electronically. Someone's coming in because they have an injury and they need some physical therapy. That's a much easier eligibility to get into, understand. So, Matt, I'm going to hand this back to you. Maybe you can filter through some of the questions and throw them out there, and either Kimberly or I can address them.
Absolutely. But firstly, thank you both for that presentation. That was really informative. I feel like I learned a lot there, and I'm sure I'm not alone in that. So let's take a look at some of the questions we've got from the chat here. And first, I think this would be a good one for Kimberly. This is from Matthew Dreyer, and he wants to know, what is the average size of the practice that you work with?
Like I said before, I've got a single guy and I've got one that has 40 different providers. But on average, our average size, we have a lot of medium-sized clients that typically have 6 to 8 providers and 1 to 2 locations.
Awesome. And follow-up question to that. In his previous experience working with outside billing companies, communication between the practice and the company was a challenge. How do you streamline that? And do you hold routine meetings with the practice to deep dive into the revenue details?
Yeah, so that's one of the differences with us. Like I said, we always keep that small business mentality, and communication is key. I always, you can always get a hold of me. Just like Steve, I give everybody my email address and my telephone number. They can call me directly. But I also have, a staff that are specifically assigned to tasks that are for every client. So if you have a question about your accounts, you have a primary collection representative that you can call and talk about specifics. If you have a specific billing question, you can always call our billing manager. We do a lot of stuff on email because I know a lot of providers, they're treating patients, right? So they can't always just pick up a phone, or we can't pick up a phone to ask them a question. So we do a lot of email communication, and if you need to, you pick up the phone, you call us. As for reports and meeting with clients, I have some clients that they never look at a report. They never want to meet with me. And then I have other clients that I meet with once a month. I've got some that I meet with once a quarter. So it depends on what your needs are, and we will set it up accordingly.
And if I can reiterate as well, when it comes to communication, again, one of the benefits of having the clinical billing solutions and Practice Perfect being aligned is, if the question is, did that patient ever pay the bill? They're standing in front of me. Well, you have access to that information. You have live Practice Perfect information that clinical billing solutions, uses and enters into. So you're always seeing what's up to date as well, which is quite key.
Awesome. Thank you for that. And our next question is from Kelly, and she asks, do you take a percentage of what is billed out or what is collected?
Yeah, I wish I could do it as billed out, but then I'd have no incentive to work for you at all. So no, it's based on the amount of collections. The more I collect, the more I get paid. So it gives me an incentive to make sure I'm working every account out there.
Yeah.
Awesome. Our next one's from Melissa. Does the billing service handle insurance authorizations, or do you require our in-clinic staff to handle that process? Also, regarding patient bills, does the billing service print and mail those to our patients?
Yeah, so with authorizations, we do typically leave that at the clinic level. A lot of times it requires input from the providers themselves with medical information that they have to fill out on those applications. So we typically leave it there because they're already having to do, at least 50% of the work to create the authorization requests. So we typically don't. We can help if need be. And we definitely try to help monitor to make sure that you're not treating outside of authorizations. And then the second part was about patient statements. Is that correct?
Yeah, that's right.
So our process with patient statements is we email out patient statements once a month. If you require us to do them by mail, we can. We have to add postage charge for that, but typically we do them via email. We've worked very closely with Practice Perfect to get that email statement run set up correctly. There's a lot of little things with different types of email addresses, but that system's going down pretty well now. So they get batched out once a month, and then if your patients have a question, they can call my staff, and my staff can go over it in detail with them.
And as I mentioned before, we are looking at leveraging something like the Wired Client with being able to text statements to patients as well. So that not so much the clinical billing solutions. Well, actually, they would be leveraging that as well. So we're looking at also different technologies to make sure the patients are aware of what they owe without hiding.
All right. Next question. Do you offer credentialing or contracting services? Is it included or additional? And that's from Helping Hands.
Yeah, so we talked about it a little bit earlier. I do offer credentialing services. They are typically extra on like a one-off little small something. Like if you just ask me to review something, I probably won't. I probably just include it. But anything that I'm going to have to put some time, significant time into, yeah, there is a charge for those.
Gotcha.
Just so you know, it's not a core part of our business revenue-wise, so I'm not like trying to make a huge profit off of it or anything. So I'm probably less expensive than a credentialing service is, but there is a little bit of a charge to it.
Next question is from Jennifer Larkman. Does the insurance payment go to us or the billing company?
It always goes to you. I don't handle any of your money directly. It'll always go into your accounts.
Very nice. Next, we have from Kathleen Sawhill. Do you post payments and write-offs to patient accounts?
We do. So our company's broken down into basically three components, which is the billing, our payment posting department, and our collections department. So I have a whole department of people. That's all they do all day long is post payments.
Awesome. From Jennifer Larkman again, do you guide us with coding to make sure we are billing all codes allowed?
Yeah, so we've been at this for a really long time. So I do, as we run across things that we feel you might not have all the information on for whatever reason, and mostly it's for compliance purposes. I mean, that's the one thing we really didn't touch on in this is compliance. And anytime I notice things that I feel are not compliant, or I feel that you're not doing 100%, I let you know. I always tell my clients, it's my job to tell you the doom and gloom, right? What's your worst case scenario, whether that'll happen to you or not. And a lot of the things I find are like documentation that's just not what I consider rock solid or bulletproof. And payers are after that more often these days, for medical necessity and looking for ways not to pay people. And right now, that's especially Anthem, that's what they're going after is your documentation piece. But for coding purposes, the same thing. If we notice something that we feel that you could be doing differently, we definitely have those conversations with you.
Got another one from Christy here. Would you just bill certain insurance companies we have difficulty with, or is it all of our billing or nothing?
We prefer all of your billing, obviously, but it depends. I mean, for us, it's all about averages, right? There's going to be some payers that are harder to collect on and some payers that are easier, which is why we average out what our fee is. But if we're only working on typically hard payers that are going to be very problematic, it is going to increase the fee that we have to charge.
And from Kathleen, for workers' comp and auto patients who need daily notes attached to the billing, do you pull the note from the EMR and send it with the claim?
So I'm going to jump in on that one. Kimberly's been on my case about that one for a little while now. So the answer is, well, Kimberly, I'll let you answer what you're doing right now, but we're trying to make it a much simpler process. Yes,
so we do. I mean, I probably, if I add up all of my clients together, a good third of the billing that we do is for workers' comp. And every single one of them requires a note to go out with it. So right now, yes, what we do is we either PDF or print the claim, and then we attach all the notes that are required. And depending on who the payer is, we will email those or fax them or put them in snail mail and get them out the door. And Steve's right, I've been on his case to make that process easier.
Melissa asks, how many employees do you have and how many clients do you serve?
I currently have 30 employees on staff with a number of remote workers that I can bring online as needed. And then we currently serve about 50 different clients, or well, 30 clients and 50 clinics.
Awesome. And one from Jennifer, do we have to sign a contract? Can it be canceled at any time?
Yeah, so yes, you do have to sign a contract. It's a 1-year contract that is self-renewing after that. There is a 60-day exit clause to it. Takes a little bit of time to wind up and wind down. And honestly, when I'm bringing on a new client, I have to consider bringing on new staff. So yes, there is a 60-day exit clause, but I'm also not trying to hold anybody hostage.
Awesome. And one from me, if I decide I want to sign up Matt's Perfect Clinic for CBS today, what does that process look like?
Well, you call me, you email me, and we talk, and then we'll work out all the details. And then from there, basically, I send you a contract and we pick up. As soon as you guys sign the contract and give me access into your Practice Perfect program, we're up and running. I'd like to say that I could do it Steve touched on the fact that he had a number of people who call him with horror stories, right? And they call me, and I actually had one person who picked up, they were actually close enough here to where I'm at that they picked up a box of the stuff that they found in the drawer and they drove it out here and they dropped it on my conference room table. So I'm sorting through all that right now. But yeah, we get those horror stories all the time where all of a sudden they're up a creek and they have no recourse. And so it is as fast as, getting a signed contract and getting us access in Practice Perfect and whatever clearinghouse you're currently using, and we can pick up the next day. Now, I usually like to give it a week or two from the time you sign to, meeting with you and doing a transition period, especially if you have staff that maybe is transitioning and leaving or something. That transition period is always helpful for both sides. So yeah, a little bit of transition period is always good, but in a pinch, we can start as fast as tomorrow.
And again, if anyone's got any questions, you all know how to get a hold of us, Practice Perfect, Matt or myself or support. Kimberly's email address is up here as well. So just any questions, no matter how big or how small, don't be shy. If it's a question about a specific situation, it can come through us and we can address it with Kimberly. So again, you should know how to get hold of both of us pretty readily.
Awesome. That's all we have for questions, guys. So thank you very much for those answers.
Okay. Well, again, I want to thank everyone for attending today. Hopefully you gained a couple nuggets of information from it. And again, if there's any questions, you know where to find us. And again, I want to thank you all for your time and hope everyone is doing well. And we hope to hear from you soon.
Thank you.
Thanks very much.
Take care.
Bye-bye, everybody.